As we age, our bodies do not respond to supplements the way they did at 40. The liver slows. Kidneys filter less efficiently, and medications interact differently. What once helped can quietly start causing harm. This is why supplement choices after 60 must be precise, not popular. Today's focus is not fear, it is clarity. Many older adults are taking supplements that either no longer work or actively increase their risk of heart attacks, strokes, kidney damage, or bone loss. At the same time, many are missing the few that truly protect aging bodies. After the age of 60, the human body operates under a very different biological system than it did in younger years. And this shift is what makes many supplements suddenly become risky instead of helpful. The liver, which is responsible for breaking down and clearing substances from the blood, works more slowly with age. The kidneys, which filter waste and excess minerals out of the bloodstream, also lose efficiency over time. This means that substances that once passed harmlessly through the body can now accumulate, reaching levels that quietly damage organs without causing immediate symptoms. Many seniors assume that if something is sold over the counter, it must be safe. But the aging body does not follow the same rules as a younger one. Another major change after 60 is how the digestive system absorbs nutrients. Stomach acid decreases, and the lining of the gut becomes less efficient. As a result, some nutrients are not absorbed well at all, while others are absorbed too slowly or unevenly. This leads to a dangerous pattern. People take higher doses trying to feel a difference. Yet the body either cannot use the nutrient or stores it in places where it becomes harmful. Fat-soluble vitamins, such as a D, E, and K, are especially dangerous in this situation because they do not wash out of the body easily. They are stored in fat and organs, and over time they can build up to toxic levels without any warning signs. Medication use is another powerful factor. Most people over 60 take at least one prescription drug, and many take several. Supplements do not exist in isolation. They interact with blood pressure drugs, diabetes medications, heart pills, blood thinners, and even pain relievers. A supplement that seems harmless can change how a medication is absorbed, how fast it works, or how long it stays in the bloodstream. This can lead to sudden drops in blood pressure, dangerous bleeding, abnormal heart rhythms, or unstable blood sugar. These reactions are often blamed on aging itself, when in reality they are caused by hidden supplement drug interactions. The immune system also becomes more sensitive with age. In younger people, the body can often tolerate large doses of vitamins or minerals without reacting strongly. In seniors, that same dose may trigger inflammation, allergic-type responses, or stress on organs. Chronic inflammation is already a major problem after 60, contributing to heart disease, arthritis, and cognitive decline. Taking the wrong supplement can quietly increase this inflammation, accelerating aging rather than slowing it. Another overlooked issue is that the needs of the body change. After 60, the body requires fewer calories, but more specific nutrients to support bones, muscles, nerves, and the brain. Many popular supplements are designed for younger adults with different metabolic demands. What once supported energy or performance can now overload the system. This is why blindly following supplement trends or advertisements becomes dangerous in later life. Perhaps the biggest risk is false security. Many seniors believe that taking multiple supplements makes them healthier, so they may ignore real warning signs from their body. Fatigue, dizziness, memory problems, or digestive discomfort are often early signals of imbalance or toxicity. When these symptoms are masked or dismissed, serious damage can develop unnoticed. The truth is that after 60, the margin for error becomes smaller. The body is still remarkably resilient, but it requires precision, not excess. Supplements should be chosen with care based on how aging organs work, not on marketing claims or habits formed decades earlier. High-dose calcium supplements have long been promoted as a shield against bone loss, but in adults over 60, they often create more harm than protection. The aging body handles calcium very differently than it did earlier in life. When people are younger, calcium is more efficiently directed into the bones where it belongs. After 60, that process becomes weaker, and the body struggles to move calcium into bone tissue. Instead, excess calcium tends to stay in the bloodstream, where it begins to settle in places it should never be, including arteries, heart valves, joints, and kidneys. This process, called calcification, silently stiffens blood vessels and increases the risk of heart attacks and strokes. Many seniors are unaware that most cases of osteoporosis are not caused by low calcium intake, but by poor calcium placement. Without enough magnesium, vitamin D, and vitamin K2, calcium cannot be properly guided into bones. Taking large calcium doses without these partners is like pouring cement into the wrong pipes. Instead of strengthening bones, it hardens arteries and strains the heart. This is why some people who take calcium faithfully for years still suffer fractures while also developing heart disease. Kidney health is another major concern. As kidneys age, their ability to filter minerals weakens. Excess calcium forces the kidneys to work harder, increasing the risk of kidney stones and long-term kidney damage. Many older adults who experience frequent urinary problems, back pain, or recurrent infections are actually dealing with calcium overload that is quietly built up over time. These symptoms are rarely linked back to supplements, yet the connection is strong. High-dose calcium also interferes with the absorption of other vital minerals. It competes with magnesium, zinc, and iron in the digestive tract, blocking them from being properly absorbed. Magnesium is especially critical for muscle relaxation, heart rhythm, and blood sugar control. When calcium intake is too high, magnesium deficiency becomes more likely, which leads to cramps, irregular heartbeat, fatigue, and even anxiety. This imbalance creates a cascade of problems that appear unrelated, but share the same root cause. Another hidden danger is that calcium supplements often come in forms that the body struggles to use. Calcium carbonate, one of the most common forms, requires strong stomach acid to be absorbed. Most seniors do not produce enough stomach acid. So much of the tablet passes through unused, while still contributing to calcification risks. This means people are exposed to the dangers without receiving the supposed benefits. Dietary calcium from food does not behave this way. Calcium from leafy greens, dairy, nuts, and seeds comes in balanced amounts along with magnesium and other nutrients that help the body handle it correctly. The problem arises when large isolated doses are introduced through pills, overwhelming the body's regulatory systems. Over time, excess calcium stiffens tissues, weakens blood vessels, and increases inflammation, all of which accelerate aging. What was once marketed as bone protection becomes a threat to the heart, kidneys, and overall longevity in later years. Iron is an essential mineral, but after the age of 60, it becomes one of the most commonly misused and potentially dangerous supplements. In younger years, especially for women of childbearing age, iron deficiency is common due to monthly blood loss. After menopause and in older men, that natural loss no longer occurs, which means iron tends to accumulate rather than decline. When seniors continue taking iron out of habit or because it is included in a multivitamin, they slowly move toward iron overload, a condition that can quietly damage vital organs. Unlike many nutrients, the body has no easy way to get rid of excess iron. Once it enters the bloodstream, it is stored in tissues such as the liver, heart, pancreas, and joints. Over time, the stored iron acts like rust inside the body. It generates oxidative stress, a process that damages cells, weakens immune defenses, and accelerates aging. This oxidative damage increases the risk of heart disease, stroke, arthritis, diabetes, and even certain cancers. Many of these conditions appear unrelated, but excess iron is often the hidden contributor. The liver is especially vulnerable. Iron overload places constant strain on liver cells, leading to inflammation, scarring, and eventually reduced liver function. Because the liver is responsible for detoxifying the blood, this damage makes it harder for the body to clear medications and other toxins, compounding health problems. Fatigue, abdominal discomfort, and abnormal liver tests are often blamed on aging, when iron buildup is actually responsible. Iron also thickens the blood. Elevated iron levels increase blood viscosity, making it harder for the heart to pump efficiently and increasing the risk of clots. This raises the likelihood of heart attacks and strokes, especially in people who already have high blood pressure or cholesterol issues. When combined with blood pressure or heart medications, excess iron further disrupts the delicate balance the cardiovascular system needs to remain stable. Another overlooked danger is iron's effect on infections. Bacteria and viruses use iron to multiply. High iron levels create an environment where infections can become more severe and harder to control. Seniors who experience frequent or lingering infections may unknowingly be fueling them with unnecessary iron supplementation. Many older adults take iron simply because it is included in a daily multivitamin. This small daily dose may seem harmless, but over years it adds up. Unless a blood test shows true iron deficiency or a doctor specifically prescribes it for anemia, routine iron supplementation after 60 is rarely necessary and often harmful. The safest approach for most seniors is to obtain iron from food rather than pills. Natural sources such as vegetables, beans, and small amounts of meat provide iron in balanced amounts that the body can regulate more easily. Supplemental iron bypasses those controls and forces excess into the system. What makes iron especially dangerous is how quietly it builds. There are usually no early warning signs. By the time symptoms appear, damage has already been done. This is why iron should never be taken casually in later life and should only be used when medically required. Vitamin A is often associated with good vision, immunity, and skin health. But in older adults, it becomes one of the most misunderstood and dangerous supplements when taken in large doses. After 60, the body's ability to regulate and eliminate fat-soluble vitamins declines. And vitamin A is stored in the liver and fatty tissues rather than being flushed out. This means that even moderate daily doses can build up over time, quietly reaching toxic levels without producing obvious early symptoms. Many seniors are taking vitamin A from multiple sources, including multivitamins, fortified foods, and individual supplements, which increases the risk of accumulation. One of the most serious dangers of excess vitamin A is its effect on bones. Instead of strengthening them, high vitamin A actually weakens bone structure. It interferes with the activity of vitamin D, which is essential for calcium absorption and bone remodeling. When vitamin A is too high, calcium is pulled out of the bones rather than deposited into them, making bones thinner and more fragile. This dramatically increases the risk of fractures, especially hip and spine fractures, which are among the most devastating injuries for older adults. Many people who think they are protecting their bones with supplements are unknowingly doing the opposite. The liver also bears the burden of vitamin A overload. Because vitamin A is stored there, excess amounts can inflame and damage liver cells. Over time, this can lead to scarring, reduced detoxification capacity, and abnormal liver function. Symptoms such as fatigue, nausea, headaches, or abdominal discomfort are often dismissed as signs of aging, yet they may be early signals of vitamin A toxicity. When the liver is compromised, the body becomes less able to process medications and other supplements, creating a chain reaction of further imbalance. High levels of vitamin A also affect the brain and nervous system. Chronic toxicity has been linked to dizziness, blurred vision, confusion, and mood changes. In seniors, these symptoms can be mistaken for early dementia or neurological decline, when the true cause is nutrient toxicity. Because vitamin A influences how nerve cells communicate, excess amounts disrupt normal signaling, contributing to instability and cognitive changes. Another overlooked issue is that vitamin A increases inflammation at high levels. Inflammation is already a major driver of aging-related diseases such as arthritis, heart disease, and cognitive decline. Instead of protecting the body, megadoses of vitamin A can accelerate these processes. Making tissues more fragile and less able to heal, the body only needs very small amounts of vitamin A, and most people easily get enough from food such as vegetables, dairy, and eggs. When supplements push intake far beyond what the body can use, the result is slow, silent toxicity. For seniors, this creates unnecessary risk without real benefit, turning a nutrient that is helpful in tiny amounts into a serious threat when taken in excess. Vitamin E has long been marketed as a powerful antioxidant that supports heart health and slows aging. But in high doses, it becomes a serious risk for adults over 60. The aging body processes vitamin E very differently than a younger one. And what was once thought to be protective can quietly increase the likelihood of life-threatening events. Vitamin E is fat-soluble, meaning it accumulates in body tissues rather than being easily eliminated. And when taken daily in large amounts, it slowly builds up to levels that interfere with essential biological processes. One of the most dangerous effects of high-dose vitamin E is its impact on blood clotting. Vitamin E naturally thins the blood, which may sound beneficial, but in seniors, this becomes extremely risky. Many older adults already take blood thinners, aspirin, or medications for heart disease. When vitamin E is added on top of these, the blood becomes too thin, increasing the risk of internal bleeding, hemorrhagic stroke, and severe bruising. Even a small fall or minor injury can lead to dangerous bleeding that is difficult to stop. Research has also shown that high doses of vitamin E do not reduce heart attacks or protect the heart as once believed. In fact, they may increase the risk of certain types of stroke by weakening the body's ability to form stable blood clots when needed. The brain is especially vulnerable to this effect. Bleeding in the brain is far more deadly and disabling than a blocked artery. This makes vitamin E particularly hazardous for older adults with high blood pressure or a history of cardiovascular disease. Another problem is how vitamin E interferes with other vital nutrients. It disrupts the balance of vitamin K, which is essential for proper blood clotting and bone health. When vitamin K is suppressed, the risk of bleeding rises even more, and bone strength can decline. This creates a double threat of fragile bones and increased bleeding, which is especially dangerous for seniors who are already at risk of falls. High-dose vitamin E also alters immune function. While small amounts support immunity, excessive amounts weaken the immune response, making it harder for the body to fight infections and recover from illness. Older adults already experience immune decline. Vitamin E overload can worsen this vulnerability. Many people take vitamin E because it is included in supplements labeled as heart-healthy or anti-aging. However, the doses in these products are often far higher than what the body needs. Food sources such as nuts, seeds, and vegetable oils provide vitamin E in safe, balanced amounts that the body can regulate naturally. Pills bypass these controls and flood the system. Over time, excess vitamin E shifts from being an antioxidant to becoming a disruptor of normal physiology. What was meant to protect cells ends up destabilizing blood vessels, weakening defenses, and increasing the risk of serious complications, making it one of the supplements that should be avoided in high doses after 60. For adults over 60, the goal of supplementation should not be to flood the body with dozens of pills, but to provide a small number of nutrients that the aging body can no longer produce, absorb, or regulate properly. At this stage of life, digestion weakens, stomach acid drops, and the ability to absorb key vitamins and minerals declines. At the same time, the body becomes more vulnerable to bone loss, muscle weakness, immune dysfunction, and cognitive decline. This is why a carefully chosen group of supplements can make a meaningful difference in how well a person moves, thinks, and resists disease. Vitamin D3 is one of the most important of these nutrients. As people age, their skin becomes less efficient at producing vitamin D from sunlight, and many seniors spend less time outdoors. Low vitamin D levels are linked to weak bones, frequent falls, depression, immune weakness, and heart disease. Vitamin D plays a central role in calcium metabolism, helping guide calcium into the bones instead of allowing it to settle in arteries and soft tissues. It also supports muscle strength and balance, reducing the risk of fractures that can permanently change a person's independence. Magnesium is another nutrient that becomes increasingly critical with age. It is involved in hundreds of biochemical reactions, including those that regulate blood pressure, blood sugar, heart rhythm, and nerve function. Many seniors are deficient in magnesium due to poor absorption and the use of medications such as diuretics. Without enough magnesium, muscles cramp, the heart becomes more prone to irregular beats, and sleep quality declines. Magnesium also helps relax blood vessels and supports healthy glucose control, making it essential for cardiovascular and metabolic health. Vitamin B12 is vital for the brain and nervous system. Its absorption drops sharply in older adults because stomach acid and intrinsic factor decline. Low B12 levels can cause memory loss, confusion, tingling in the hands and feet, balance problems, and anemia. These symptoms are often mistaken for normal aging, but in many cases they are the result of B12 deficiency. Adequate B12 supports nerve repair, red blood cell production, and mental clarity, helping seniors stay sharp and steady. Omega-3 fatty acids from fish oil are powerful protectors against inflammation, which is one of the main drivers of aging-related disease. Chronic inflammation damages blood vessels, joints, and brain cells, contributing to heart disease, arthritis, and cognitive decline. Omega-3s help calm this inflammatory process, support healthy blood flow, and protect the heart and brain. They also improve joint lubrication and reduce stiffness, making movement easier and less painful. Together, these four nutrients address the core vulnerabilities of aging: weak bones, declining brain function, and rising inflammation. When taken in appropriate amounts, they support the body's natural ability to repair itself and maintain balance. Instead of overwhelming the system, they provide exactly what the aging body struggles to supply on its own, creating a foundation for strength, clarity, and resilience well into later life. As this discussion comes to a close, one truth stands out clearly. Aging does not mean losing control of health, but it does mean becoming far more selective about what enters the body. After 60, the rules change. The same supplement that once seemed helpful can quietly become harmful, and habits that were formed decades earlier may no longer serve the body today. What matters now is not quantity, but precision. Removing what creates damage and keeping what supports healing is one of the most powerful decisions a senior can make. Many older adults knowingly take supplements that increase their risk of heart disease, fractures, kidney strain, and cognitive decline. High-dose calcium can harden arteries instead of strengthening bones. Iron, when not medically required, can overload organs and accelerate aging. Megadose vitamin A weakens bones and stresses the liver. High-dose vitamin E raises the risk of dangerous bleeding and stroke. These are not harmless pills. They are silent stressors that slowly chip away at health while giving a false sense of protection. At the same time, the body after 60 has very specific needs that are often neglected. Vitamin D supports bone strength, immunity, and muscle function. Magnesium keeps the heart rhythm steady, relaxes muscles, and helps control blood sugar. Vitamin B12 protects memory, nerves, and energy. Omega-3 fatty acids reduce inflammation, protect the heart, and support the brain and joints. These are not trendy supplements. They are foundational nutrients that aging bodies depend on to stay strong, clear, and independent. True senior health is not built on fear or on taking everything on a store shelf. It is built on understanding how the aging body works and giving it exactly what it needs to function at its best. Small, smart changes can produce powerful results, even later in life. When harmful supplements are removed and the right ones are added, the body often responds with better energy, improved balance, clearer thinking, and reduced pain. The message is simple, but deeply important. Protect the organs that keep you alive. Support the systems that keep you moving. Nourish the brain that holds your memories and independence. Aging well is not about fighting time. It is about working with the body in the way it now requires. When that happens, strength, clarity, and vitality do not disappear with age. They become something that can still be protected and even restored.